Gangrenosum in ulcerative colitis. Personal data. My name is Arlet Bravo Montes. My teacher is Moscoso Escobar John Fernando. Definition. Pyoderma gangrenosum is a rare inflammatory, non-infective, and non-neoplastic skin disorder. PG is often associated with systemic conditions such as inflammatory bowel disease, rheumatoid arthritis, paraproteinemia, and hematologic malignancies. Continue the video.
Pyoderma gangrenosum. Pyoderma gangrenosum, an ulcerating condition of skin that results in heaped borders with a typical appearance. Pyoderma gangrenosum appears to be mediated by the immune system, but the exact cause is unknown. The lesion usually begins as a soft nodule on the skin that then ulcerates. The ulcer enlarges, and the skin at the edge is purple-red. The ulcers can become quite large. Pyoderma gangrenosum is associated with several other diseases, including ulcerative colitis, Crohn's disease, rheumatoid arthritis, leukemia, and cryoglobulinemia. Pyoderma gangrenosum is usually responsive to corticosteroids. Pyoderma Pyoderma gangrenosum.
Application in males. There are some previous reports suggesting that UC and PG, at least in part, share a common pathogenic immune mechanism. For example, one report proposed that the skin merely reflects the primary pathogenic process in the colon as a Schwartzman's phenomenon. Another report suggests that human complex from inflamed intestinal mucosa cause cutaneous lesion. Furthermore, recent report suggests that IL-15 and IL-8 play an important role in the relationship of PG and UC. Pros and cons. The patient's skin lesion improved after initiating systemic mesalazine therapy. Mesalazine is the standard first-line treatment for mild to moderate UC, and installs the anti-inflammatory through induction of peroxisome proliferator, active receptor gamma gain expression, and nuclear factor kappa B activation, as well as inhibiting prostaglandin and interleukin-1 synthesis. Cons. Skin lesion and bowel symptoms do not improve with prednisolone. Continue the video.
Welcome to the Health Channel. Pyoderma gangrenosum is a fairly rare skin condition that affects both males and females. It is not age-defined, but it is more common in the young to middle-aged group. The most likely affected areas are usually the legs, arms, and neck, although it can also develop on the head or genitals. Even though Pyoderma gangrenosum is a skin infection, it can bring on high temperature and feelings of sickness. The first indication of Pyoderma gangrenosum is usually the appearance of small red bumps or pimples that quickly grow larger. As the pimples or bumps grow, they then develop into ulcers that are painful and may ooze or weep fluid. The condition is treatable with creams and medication with positive results, but there is a high possibility of scarring. It is important that you consult a doctor or skin specialist before attempting to self-treat, as Pyoderma gangrenosum is quite a serious condition and should be treated properly to minimize the risk of infection or scarring. To learn more about Pyoderma gangrenosum, please click on the link in the description below this video.
Issue update. Approximately 13% of the cause of PG develop in patients with inflammatory bowel disease. Every size forecast report of PG develop in chronic UC patients have been published. In 1932, several reports have suggested that the development of PG was closely associated with active UC or Crohn's disease. However, in a study of 18 patients with PG, there was no consistent relationship between PG disease course and that of other associated with disease, including this as short as the relationship between the clinical course of PG and UC remains controversial. Continue the video.
I've had Pyoderma gangrenosum for 10 years and 1 month. I was treated for venous ulcers for 5 of those years. That involved triple layer bandaging, being told not to get the ulcers wet, and the surgeon wanting to remove my non-existent varicose veins.
Pyoderma gangrenosum is a rare and very painful skin condition that causes rapidly spreading ulcers on the skin. It's an autoimmune condition that's also associated with other autoimmune conditions such as rheumatoid arthritis.
I decided to do the stopgap trial in the hope of finding a cure or a standardised treatment. I don't want anyone else going through what I've been through. I want patients who have this condition to be diagnosed promptly and given the help we deserve.
Pyoderma gangrenosum can sometimes be treated with topical medications such as potent or super potent topical corticosteroids, but usually systemic therapies are required. And the 2 most commonly used systemic treatments are oral prednisolone, which is a steroid medication, or cyclosporine, which is a drug that affects the immune system. And we wanted to compare these 2 most commonly used systemic therapies head-to-head in the stopgap trial. Doctors and patients can choose either of these treatments, safe in the knowledge that whichever they choose is likely to have similar benefit, and they can choose one that suits their own preferences or their other comorbidities that patients might have. Our big surprise really was that neither medication worked terribly well. After 6 months, less than half of the patients' ulcers had healed, and in those who did heal, 1 in 3 had a repeat attack. So this suggests that we urgently need new treatments for Pyoderma gangrenosum.
It's the pain that interferes with my daily life the most. It has driven me and my partner to the brink of insanity. It's the knowing that every time you reposition yourself, or if you need to get up, you're going to be in the most awful pain. I also get sudden nerve pain in my legs, and it's enough to make me yelp. It puts me off moving. On bad days I stay in bed, only getting up for comfort breaks and to take more medication.
The stopgap trial helped to raise awareness of this painful and debilitating condition, which is often misdiagnosed. These results are now being widely disseminated amongst many healthcare professionals, and patients themselves have been encouraged to take along the results of the study to share with their healthcare professionals. So for the first time, it means that patients and doctors can use this best quality evidence to make informed decisions about what's best for them.
I live in hope of getting better, being able to lose weight and getting back to work. I hope.
Conclusion. Although no studies have been published on the effect of systemic mesalazine therapy on PG, a case of successfully treated PG with topical mesalazine cream was reported previously, and the authors suggest that leukocytes motility and cytotoxicity were suppressed by mesalazine. In PG, the patient's bowel symptoms and skin lesions started to improve concomitantly a few days after imitating mesalazine. Therefore, that systemic mesalazine can be an effective option for the treatment of PG, especially when associated with UC. Continue the video.
A patient came to you with the features of inflammatory bowel disease such as bloody diarrhea, and the patient is suffering from an ulcer in the medial malleolus. Think of Pyoderma gangrenosum. Pyoderma gangrenosum is a common topic in the MRC, USMLE or AMC examination. So I'm Dr. Amin Anwar. You are watching my channel MedTech. So we are going to discuss about Pyoderma gangrenosum. So let's begin. Pyoderma gangrenosum is a non-infective necrotizing ulceration with a clear-cut bluish-red border with overhanging edge. So what are the causes of the Pyoderma gangrenosum? Most of the causes, there are idiopathic, there are some inflammatory bowel disease, which is the most common cause. Then there are some myeloproliferative disorders such as polycythemia rubra vera or chronic myeloid leukemia or lymphoma. There are causes such as rheumatoid arthritis or SLE. There is primary biliary cirrhosis or chronic active hepatitis, hemoglobin A gammopathy or multiple myeloma. So what the investigation should we do for Pyoderma gangrenosum? It should be addressed according to the cause. First of all, in case of inflammatory bowel disease, we should do a colonoscopy with biopsy. In case of myeloproliferative disorder, we should do a CBC with PBF, with a bone marrow study, with JAK2 mutation study, and in case of multiple myeloma or hemoglobin nephropathy, we should do a serum protein electrophoresis. In case of primary biliary cirrhosis, we should do an antimitochondrial antibody, etc. And what the treatment should be given in case of Pyoderma gangrenosum. There are some local and some systemic treatment. In case of local treatment, first of all, we should do daily dressing, raise the limb, and the limb should be elevated. The analgesia should be given. Then secondary bacterial infection should be prevented with antibiotics. Then very potent steroids such as clobetasol propionate 0.5% should be given locally, and intralesional steroid can be given. And in case of systemic therapy, we can give tapering dose of high dose of corticosteroid, cyclosporine, sulfasalazine, minocycline, or dapsone. So guys, that's all for today's Pyoderma gangrenosum. I hope this video helped a lot. If you like the video, please press the like button. If you have any query, please comment below. I will try to answer your questions. And please share and subscribe. Thank you.
Thank you.